global issue first. One, this mental health conversation is kind of a very recent conversation. It used to be there, but in a different manifestation. Even as a government, it's only until I think 2018, 2019 that the government actually have set up a task force to deal with mental health. So you can see we are very young, and therefore in terms of operationalizing mental health in the workplace, it's kind of a long journey. We just have only started the first maybe layer of the implementation, even understanding, sensitizing people. There's even still some trauma around it, because would you want to kind of go and tell somebody you have a mental health issue? Or would you even, how would you feel if somebody tells you you have a mental health issue? Okay? You can see even the stigma that it has there. So we have a long way to go. I can say something that is at a very early stage. And therefore, I'm not shocked about the statistics, because only those who at early adoption, and most of them you find they are a bit more mature organizations that are well established, that have the right infrastructure even to be able to do that. So one, I would say, first of all, to the employee side, even to have them have good, environment where they can come and tell HR, I am battling with this. I'll give you a case in my own personal case study. And this is a real situation of a company that I was consulting for, and there's a lady who used to report a bit late in the morning. And when she was reporting in the morning, therefore her performance was kind of deteriorating, and she was almost to be fired by the employer. But just before firing, because she was put in performance improvement plan, and then after that, there's a legal process to be able to release somebody out of performance. But the employer decided, no, wait, let's just do a bit of counseling. So they sent the employee to a counseling. So the counselor actually discovered this employee have a mental health issue. And because of that, even her brain is kind of damaged in a certain way that it takes her almost 3 to 4 hours in the morning to fully function. You know that you open your gadget, your device, a tablet or a laptop, and it takes like 4 hours to actually get into a state that it can function. So the employee is not performing because she has a condition, but she never disclosed to the employer she has a condition that disturbs her productivity in the morning. And the employer was almost firing this employee. But when she went to the counselor actually discovered there's an issue here. It takes her almost 3-4 hours before even her brain fully get activated to work. And therefore, between 8 up to around 10, the employee is not working. She's just there physically. Now, what did the employee, what did the counselor do? The counselor said, this employee is quite a brilliant lady. So let's change just have a certain discretional shift of her working schedule. Instead of her reporting at 8, allow her to come at 10. What's wrong with that? And she was given a kind of a flex hours, where instead of, others are coming at 8, the employee come at 10. By just changing that shift between now, instead of working at 8, come from 10, and then maybe stretch up to around 6, the employee actually was among the top performing employee of the year within the next 1 year. What I wanted to say is that the adoption of the mental health adjustment or support system, it's at a very early stage. This is the time even we are sensitizing. There was no budgetary allocation even of the government itself 5 years ago. It just started from 2018, 2019. It's when we started now a new task force that have been funded. In fact, the first time even I think to have like a budget allocation for mental health advocacy is just less than 4 years ago. So we still have a long way to go. On the employer side, of course, we are also trying to adapt what we call the well-being programs. There are some companies that have what we call a wellness program. Now we are shifting from wellness to what we call well-being, where we say we want the employee as a whole. Meaning, we want even to contribute to the factors that affect you at home. That is your wife, your spouse, your children, where you stay, because now it's no longer beyond just I am contract kitani. It's beyond that, because you can be affected in terms of productivity by factors that are beyond, the work engagement. Those are things that in terms of where you're staying, the environment you stay at home, in terms of your relationships, that's your family and no others, that can affect the work. So we actually are coming up with some innovative ways of how to actually have an integrated well-being, because when I hire you, I'm not just hiring Kitani, I'm hiring the whole ecosystem around you. So employers are going beyond just the normal transactional engagement, which is just a mere contract, and then push you towards productivity. So I say, statistics, yes, as they are reading, around a third adoption, but we're at a very early stage. That's why there's a huge advocacy work happening in the marketplace currently to sensitize HR, sensitize employers to start accommodating these as a critical component of the employee issues. So I expect, I'm very hopeful that maybe within the next 4 or 5 years, we are going to have a bit more higher adoption of wellness program within the workplace.
You've talked about,